Hi, on today's episode of Psychology from My Kitchen, this is Mrs. Ryan from Sylvania Northview High School, and we are talking about the treatment of abnormal behavior, which is part of Unit 13. Lucky 13, almost finished with the year. Or it is the second part of Unit 8 under the College Board's guidelines. So treatment of abnormal behavior. We have spent time talking, I gotta make myself small. So we have spent some time talking about what different types of abnormal behaviors are, specifically to mental illness and our major categories of mental illness. Obviously, we did not cover every single one of them as is recorded in the DSM-5 because there are several hundred pages in that text. So just the highlights. So when it comes to the treatment of mental illness, there are really only two major ways that we go about treating mental illness. There is going to be what's known as psychotherapy and psychopharmacology. So in today's lesson, I'm going to be focusing on psychotherapy, and in our next lesson, we'll be talking about that piece of psychopharmacology. So in psychotherapy, you have a person who is trained in specific techniques in which to assist someone seeking to overcome difficulties or achieve personal growth. So likely you have someone who is either suffering from mental illness or is experiencing hardship in their life that benefits from the same kind of uh, psychotherapy that would behoove a person who is experiencing mental illness as well. So just because a person is utilizing psychotherapy does not necessarily mean that they have a mental illness. Psychotherapy can be tremendously beneficial to anyone who is experiencing major life events that can produce stress in their life and to help them overcome that stress or that anxiety that can be created. And I always encourage individuals to seek out help if they find themselves struggling during any period of time. So there are actually different ways that a psychotherapist might go about treating someone, whether that be a person with mental illness or not. But many psychotherapists are going to follow what's known as an eclectic approach. And what we mean by that is they take different pieces of our major techniques and kind of put them together to fit the needs of specific clients that they see in their practices. And so that's something to note that here we're going to talk about what some of those major techniques are, but know that some techniques are going to be more beneficial towards certain problems and not others, and that depending on the unique situation of a person, one type of therapy technique might be better suited than another. And so it's highly dependent on the circumstances surrounding why a person is seeking out help in the first place. So one of the first major types of therapies that was developed comes from our humanistic perspective. Now, we have talked about the humanistic perspective in psychology and how that relates to our optimal growth. We talked about like Abraham Maslow and Maslow's hierarchy of needs, where we are attempting to self-actualize, to become the best version of ourselves. And so humanistic therapy is based on that same principle, that same belief that any person could achieve self-fulfillment. Any person could become better, essentially, right? To be the best version of themselves. And what we have here is a person who is looking to be more accepting of who they are, right? That I'm not necessarily trying to cure you in what might be wrong, but instead trying to help you understand and accept the person that you are and identifying strategies that could help you improve to be a better person. So the focus is much more not on what has happened to you in the past to bring you to the point that you're at, but instead what is your future self going to be like, and how could that future self be better than your current self? The humanistic perspective and this kind of humanistic therapy can be really beneficial towards especially individuals who experience like personality disorder, something like that, where there isn't necessarily a cure for what's happening, but there are strategies that you could do to help yourself improve and become more functional in society. One of our major humanistic, how do I want to say this, founders, if you will, I suppose, is going to be a psychologist by the name of Carl Rogers. And Carl Rogers is really at the forefront of developing psychotherapy techniques that can be beneficial to all clients, something that, regardless of what strategy of therapy that you're using, are going to be widely beneficial. And one of those techniques is known as client-centered therapy. So in client-centered therapy, it is truly believing that all persons have the capability of becoming better, right? That all persons can grow. It's that whole growth mindset, essentially. And that by having this growth mindset about your clients, you accept them for who they are, you have the genuineness in your interactions, and you are empathetic towards whatever type of experiences and truth that they might hold. And this is one of the big ways that therapy really differs from people seeking out help from loved ones, for example, right? Unloading on your best friend about, these struggles that you're having, that while they might be your best friend and they might, care about you and everything, they aren't necessarily going to give you the best advice about what it is that you can do. They're not a professional, they're your friend. Um, and we don't always act with a lot of empathy towards others when they tell us something that they're doing and we can maybe clearly see how it's wrong. But we don't know how to go about telling them that it's truly wrong. And this is really where a professional can be beneficial in that kind of situation. Something else that this client-centered therapy is known for creating is a technique known as active listening. In an active listening procedure, what's going to happen is that the client will make a statement about whatever experience they're having, and the therapist will echo back or will restate what it is that that person said and seek out clarification to truly demonstrate that not only do they hear that person speaking, but that they want to clarify and make sure that they are fully understanding what that person is saying. So many times, especially in the modern technology lifestyle that we have, when people are listening to us, we don't always truly listen. I mean, right now, you might be listening to this talk and have your cell phone on you and you're getting text messages and TikTok videos or, Snap stories. And are you truly listening to what it is that I'm saying? I mean, I have no idea because I'm talking to a computer right now. But if we were face to face, how would I truly be able to know that you are listening to me and that you can hear me? And that's where that active listening is very important. Um, these types of therapists also try to promote a technique known as unconditional positive regard. Unconditional positive regard is the idea that I am going to care about you and I am going to want good things for you no matter what it is that you have done in the past. The term comes from the idea of unconditional love that, fortunately for many children, they experience with their parents, that the child could screw up, the child could do something horrible, and their parents continue to love them no matter what, no matter how many times that this person has hurt them, that they have this unconditional love for them. And so this technique of unconditional positive regard is that no matter what it is that you tell your therapist, they still trust you and they still believe in you and they still want good things for you, even if maybe you insult them, maybe you are hurtful to them personally in some way, that despite those things they still want the good for you. So switching gears to another therapeutic technique is something known as behavior therapy. Now, behavior therapy is based off of the behavioral principles that we studied earlier in the year that deal with things like classical conditioning, operant conditioning, and observational learning. So, what you would do here is apply those kinds of theories to try to eliminate unwanted behaviors. And so, our behavior therapies are often really beneficial towards our anxiety disorders, in that we might reduce anxiety by eliminating an unwanted behavior that anxiety produces. Behavior therapy really doesn't care so much about where your problem is coming from. So, like if you're talking about anxiety, behavior therapy is not as concerned about what caused your anxiety in the first place, like reliving past events or something like that to get to the root of why you are anxious, but instead focus more on changing those behaviors so that you can be more functional. There are some positive and negatives to both of these things. And that's why, again, we often use that eclectic approach where we typically wouldn't just do behavior therapy. We might add something else into it. One of the reasons why all this came about actually is because of our dear friend, little Albert. So we've told the story about little Albert in the classical conditioning with the white rat and the loud gong sound, and how little Albert then became terrified of all things that were white and furry. Well, a psychologist by the name of Mary Cover Jones, of course, is studying little Albert. And like most of you, she's pretty horrified about the idea that we purposefully terrified a small child for the knowledge of it. Um, and she wonders, could we potentially recondition little Albert? Now, of course, we know that that's not possible, but if we had a child who was in a similar situation, could we potentially change their behavior for the better? And so she developed something known as counter conditioning. So, like if you had a child who was terrified of a white rat, could you pair that white rat with some sort of pleasant stimulus and essentially start developing positive reinforcement for being around that anxiety provoking stimulus like a white rat? And that's exactly what she does. And she finds that this counter conditioning method is really helpful. Um, Another psychologist who takes this a step further is a man by the name of Joseph Wolf. Now, Joseph Wolf wants to start doing exposure therapies where you would, especially like with phobias and things like that, you would expose a person to what it is that is anxiety provoking. So this might include something like a virtual reality exposure therapy, which when we talked about phobias, and especially like people who have a fear of flying, that I could utilize this virtual reality exposure therapy to help ease into actually getting on a plane and flying. Now, we recognize that an exposure therapy is not going to be beneficial if I just, you know, throw this anxiety provoking stimulus at my client and, hope for the best. The idea about like a kid who's terrified of swimming, you just push them into the pool. Well, that's exposure therapy. We recognize that that's probably not going to be helpful. But what you could do is something known as systematic desensitization. So, in systematic desensitization, you are slowly exposing this person to the anxiety producing stimulus. So, we take an example of a kid who's terrified of the water. Pushing them into the pool, gonna make them more terrified of the water. So, we would want to introduce water as something pleasant, but do it literally in small amounts. So that might be something like, playing with water that is found in a puddle, something that is stationary, something that would be in a bowl, something really small. And working your way up to being exposed to water in larger and larger quantities, systematic desensitization, much more successful in being able to, expose that person to their anxiety producing stimulus. In institutional settings where we know that uh, having cooperative behavior around other people is very important to the success of the experience, we might institute the use of what's known as a token economy. Token economies are pretty normal in like the classroom setting, institutional setting, but you might also see it in mental health facilities. You might see them in jail or prisons as a way to reward good or desirable behavior so that you can maintain that good or desirable behavior. So, for example, I know that one of my colleagues uses rubles. And so you earn so many rubles, or I know in the world language department you have euros, and that you can collect these as part of your good behavior, and that turn them in for some sort of prize. And so you're using positive reinforcement as a way to reward those good or desirable behaviors as opposed to punishing bad behaviors. We know that this is successful in changing behavior, and especially if those behaviors are dysfunctional, this can be really successful for us. Another type of therapy technique that some will use is what's known as cognitive therapy. And in cognitive therapy, I am attempting to change the way that I think, which is significantly more difficult to actually do than to just say. So, what you're trying to do is to get people to look at situations from different perspectives, trying to explain events in a different way, as a way to change their mode of thinking and perceiving. So, for example, if you take losing a job, right, that losing a job can be devastating for anyone, regardless of the circumstances surrounding why they lost a job. So, if that person has that really horrible stimulus in their lives, but then they also perceive it because of like a personal failing, for example, I lost my job because I am worthless, this significantly increases the likelihood of experiencing symptoms of depression, for example. However, if I reframe my experience, if I have a different cognitive outlook as to what happened, I lost my job. Why did I lose my job? Maybe I lost my job because my boss is a total jerk and I really deserve better. That's a totally different approach to the same stimulus of losing a job. And perhaps when I explain it this way, I'm less likely to experience symptoms of depression. So cognitive therapies are beneficial in our anxiety disorders as well as our depressive and bipolar disorders, where I can potentially change my outlook on how I am perceiving the events around me. And again, this is a really difficult task to do. And that's why this type of therapy can be quite extensive, that somebody might be utilizing this therapy for a fair amount of time. Now, because we are, ever evolving in our ways that we try to utilize therapy, other types of therapy techniques have come about, one of those being rational emotive behavior therapy, REBT, which was developed by a psychologist named Albert Ellis. And so this is a form of cognitive therapy where you're really challenging the way that you think about yourself. So that illogical, self-defeating attitude, those assumptions that you make about yourself. But to be honest, Albert Ellis was pretty harsh on patients and clients and how he dealt with this. And so another psychologist by the name of Aaron Beck really tries to soften that strategy for depression and really be more about like exposing how this could be an irrational thinking pattern. So like, if somebody is self-explaining why something happened to them, that Beck is going to strategize that, maybe we soften that a little bit, but still point out, that's not really a logical way to think about this. How can we think about it differently? By far, one of the more popular types of therapy techniques is something known as cognitive behavioral therapy, or CBT. CBT is a type of therapy that is going to combine our behavior therapy and our cognitive therapy, so that not only am I trying to change the way I am thinking and perceiving the world around me, but I'm also attempting to change behaviors that I am experiencing. So let's say, for example, that I am suffering from depression, and part of my depression is that I feel isolated and lonely from other people. And I perceive this as the fact that other people don't like me. I am not popular. I am not somebody who is worthy. And so therefore, people don't like me, and this is going to contribute to feelings of worthlessness. So if I were to use cognitive behavioral therapy for this particular client, I might get them to think about, okay, well, if other people aren't liking you, is it possible that they don't know you? And if they don't know you, that they don't feel as comfortable reaching out and inviting you to something. And so here I'm trying to take that idea that I'm not liked into maybe it's not being liked. I mean, that is still a possibility, but instead, could it just be a lack of knowledge? And so that's the cognitive part. But then I might have like a homework assignment for this client saying, what if you reached out to a coworker and invited them to lunch? And maybe in like the 1 month between seeing your therapist, part of your challenge, part of your homework is to reach out to 2 different coworkers and invite them to lunch and use that as an opportunity to get to know each other better. They might say no, they can't, they have to reschedule, something like that, and that happens, but you're changing your behavior where you would not necessarily think to go out and ask somebody to join you for lunch. So I'm trying to combine that cognitive piece as well as the behavioral piece to ultimately try to create better outcomes for me. Finally, make myself bigger. Finally, our last type of therapy, psychotherapies that are utilized from a lot of different perspectives are going to be our group therapies and our family therapies. So group therapy is a belief that a lot of times people are thinking that their experiences are unique, that no one can understand them, nobody gets what it is that they are going through, and therefore, they're kind of in this battle all by themselves. And group therapy is a way for individuals to come together who all have similar experiences to talk about those experiences and share with one another. And that it lessens the burden, right? It creates a better social connection with those who around us who are also struggling, and that it can create a support network that was not there previously. So this is actually a basis of things like Alcoholics Anonymous, that in AA, where, as it's depicted in movies and TV shows, that, a person sits around, they talk about their problems are, right? Hi, my name's Sarah, that kind of a thing. But you're creating a social network of others who truly understand what it is that you're going through. And that is a treatment format that can be really helpful for certain clients. Like I mentioned with like drug and alcohol addiction, but also for like eating disorders, as an example, that can really be helpful. And then finally, we have family therapy. So what we often forget is that as an individual, even though you may feel ostracized and alone, your actions, your thought processes, they have an impact on your family members, that you are part of a family unit, no matter how close your family is, that you're still part of it. And that when you are dysfunctional, it creates dysfunction in the entire family unit. And a lot of times, like if you're talking about parents who have children who are dysfunctional, they, try to act as therapists and they're not, they're parents. Or like siblings that they try to offer support, but they don't necessarily know exactly how to do that and what's the best role to go about it. So in family therapy, what you're doing is you are treating either the mental illness or whatever the dysfunction might be, you're treating it as a whole. And you're treating all persons who are involved. And when a therapist takes on the role of the therapist, the job of therapist gets removed from the siblings and the parents and the best friends, and they can go back to being the siblings and the parents and the best friends, which is a role they're really supposed to be doing in their lives. And so therapy is a way, family therapy is a way to kind of treat this as a whole communal problem as opposed to just an individual problem. And it also helps bring issues more out into the open, that if things are staying bottled up and no one's saying and then they're not being addressed, that doesn't help correct problems. And that's another thing that can come up with family therapy. So we are going to stop there for today. In our next session, we will talk about psychopharmacology as well as other types of medical procedures that might be used to help those with mental illness. So until then, you guys have a great day.